It is my privilege to present the following program that was inspired by the way American businesses and organizations have responded to the events of September 11th. It's part of a special series produced by Heartbeat of America called Keeping America Strong. Each program spotlights a business or organization that is helping to do exactly that, keep America strong. Having served in the United States Navy for many years, I fully appreciate the important role small and middle-sized businesses play in the very fabric of our country, and I salute the professionals who lead these companies and thus keep America strong. They are the very backbone of our free enterprise system, and today on this program you will meet the individuals behind one such organization. I'll be back later in the program to introduce the Keeping America Strong Award. And now, let's learn more about the organization we are honoring today.
Today, the eyes and ears of the 21st century are focused on new developments, new technologies, new emerging companies. We're on the scene to bring it to you as it happens.
We anchor from our new studios in Los Angeles and then go out all over America to get to the heart of the story.
I'm Bert Tenzer.
I'm Bella Shaw.
I'm Doug Llewellyn.
And I'm William Shatner, and this is Heartbeat of America. Since 2001, our television series has been featuring entrepreneurial companies that move our country and our economy forward. Standing by at our studios in Los Angeles is one such company. Welcome. Good to have you with us. All right, let's begin by telling me what you do and who benefits from it.
We are an interdisciplinary medical group focusing on solutions for complex musculoskeletal problems, including pain, arthritis, and various sports injuries.
Well, you're obviously successful, so what do you attribute your success to? Any particular philosophies or strategies?
Well, interdisciplinary medicine is the future of musculoskeletal medicine, and by combining specialists of different areas together, it's more convenient for the patient and better medicine.
Now, stay with us. There's more to come.
Thank you very much, William. I'm Doug Llewellyn, now here in our studio in Los Angeles with our guests tonight, who are all doctors that are members of a group of doctors in San Francisco. The group is called Soma Orthopedics Medical Group. Again, they're in San Francisco, and it's really unique. Talking with these doctors, you realize they are different. They are doctors with hearts, and as they put it, their specialty is cutting-edge interdisciplinary medicine, and we're going to find out what that means. The doctors are specifically Dr. Dave Atkins, who is a specialist in orthopedic surgery. He also happens to be, interestingly, a little sideline for him, he is a neutral physician with the NFL in San Francisco, and you will find out what that means in a moment. Dr. Moshe Lewis, who is a physiatrist, you'll find out what that is, and also Dr. Claudio Palma, who is a pain management specialist and also an anesthesiologist. Those are the doctors on board. We're going to meet first two of the doctors who are with me right now in the studio. Dr. Dave Atkins. Dave, welcome. Nice to have you with us. And Dr. Moshe Lewis. Moshe, welcome. Nice to have you here. Tell me a little bit about your own description of your group. How do you describe it, Dave?
Well, I think our goal is really clear. We want to provide the best medicine for our patients. Specialization in medicine is very important because it's very hard for any physician to keep abreast of how rapidly his field changes. But it can be an incredibly frustrating experience for the patient because the doctor may not have a solution for their problem, and they may find that they're at the wrong type of doctor's office entirely. What we hoped to do was to bring all the physicians together to make complex decisions with communication between the specialties, and to set up, as you would have it, a one-stop shop where patients had everything that they needed in the same place.
When you say everything you need, I mean, it's interesting because this is a rather unique group of specialties you have here. Let me ask you something, Dr. Lewis. Physiatry. A lot of people hear me say that and are wondering, what am I talking about? What is a physiatrist?
Sure. Physiatry is a newer field. It emerged after the war when we started seeing veterans come back with various injuries, and they still were rehabable, and so we used rehabilitation medicine to really help people become their all. The field also formally is called physical medicine and rehab because patients are going to get physical therapy, and we're actually going to touch the patients hands-on to really figure out how can we get them to walk better, move better, and essentially maintain as full an active life as they can. Now that time has continued to go by in the field, what we really find are literally patients that are young and may have a small injury, a tendinitis, to patients who are quite elderly and are actually dealing with degenerative disease and breakdown of some of their joints that's making them stiffer. So really we do cover quite a spectrum of care for these patients, trying to optimize their function.
Give me a typical idea of what kind of problem I might have that would direct me to you.
Sure, excellent question. Classically, patients that we see in their 40s and 50s, a lot of times we refer to affectionately as the working wounded, will have back pain or will have stiffness in some of their joints, maybe an old sports injury that's really starting to flare in their shoulder and not allowing them to fully do some of the things that they want. They may find that pain flares up from time to time, and again, we commonly see this in the back or in the shoulder.
And would that be arthritis?
That can be an early form of arthritis. We now are thinking about arthritis on a spectrum where early on patients may have a bursitis or a tendinitis, some of the tissues around the joint being inflamed, and then over time it emerges into an acute inflammatory stage where patients will tell you, my knee is really swollen, it's hot, it's tender, and then there are other times where it's just stiff and painful for them to move or walk.
All right, so you're talking about patients with pain. Another doctor on your team is a specialist in pain management. Would you two get together on the same patient?
Absolutely. Sure. And I think that that's one of the benefits of the model of having doctors work together. I think it also acts as a model for the future, where certain patients may need more than just some of the physical therapy or just even what medications can do. They may need special interventions, injections, and a very high level of sophistication with respect to managing their pain to really minimize meds. In our society today, a lot of patients are stating they don't really want to take meds, and certainly not meds that can be causing other problems to their kidneys or their liver. So as a pain specialist, Dr. Palma can really help minimize those types of patients needing long-term meds.
Well, that's really pretty interesting. Let's turn to the orthopedic situation. I know you do things like replacing knees and elbows and joints and a lot of orthopedic surgery. But you were telling me there's something new going on, especially when it comes to replacing knees. You're not always replacing the full knee, right?
Well, Doug, this is an extremely exciting time to practice orthopedics, and I think we're on the cusp of a real change within the field. In the beginning, we looked at structure. We said you had a torn ligament or a torn cartilage. And now we're starting to look at joints biologically. We're saying your joint is billions of cells in equilibrium or in disequilibrium. So, ironically, as a surgeon, a lot of what's new in my field doesn't involve actual intervention. It's biologics, the newer injections that are very good for your knee, the newer bone stimulators that can heal a fracture without having a surgical intervention. Now, as far as the interventions in surgery, things are literally exploding. There are new materials that we're using, such as ceramics or metal on metal, which have a much longer life, much less allergy. Anyone who's ever worn jewelry and had a severe allergy, you can have the same allergies with conventional joint replacements to nickel or cobalt chrome. Now we're seeing the emergence of ceramics and ceramic-like materials, metal on metal, that don't have these problems and have a much longer life. Another aspect of the field that's very interesting is minimally invasive surgery. Instead of making large incisions and big cuts, we can now do things like hip resurfacing. Rather than cutting out the whole top of your hip, we can simply resurface the top of the hip with a highly polished shell, which gives someone a hip that feels much more like a normal hip and has much greater longevity.
That sounds very, very exciting. Technologically speaking, there have been many advances in this field.
It is literally, the field is literally exploding. It is an extremely exciting time to be an orthopedic surgeon.
So how does a doctor like you keep up with all of this? And how do you make sure you're able to take advantage of all these technologies and be able to perform them adequately?
Well, I'm affiliated with several universities, and I think through teaching you really keep abreast of the cutting edge technologies. I think it's not just being a specialist, but being very dedicated to understanding these technologies. I also have a role in evaluating new technologies as a consultant, and not all technologies are the best for the patient. You have to make a critical decision whether it's an efficacious intervention for the patient. But you really do have to keep abreast of your field, and I think that's where specialization comes in.
Your practice is located in San Francisco. You're in the Mission District. But where do your patients generally come from? I mean, are they all right in that area? Are they throughout the city?
Sure. We see patients not only from San Francisco, but as far away as Central California and well into Northern California and up into the Oregon area. We find that patients are attracted not only to a city like San Francisco because of its diversity, but because when they find a practice where they're really treated with care and they don't have to see multiple doctors in different locations, it really makes their trip worthwhile. Also, just the closeness of the doctors being in the same office allows us to literally get that curbside consult real time. It'll be nothing for me to stop and touch base with the surgeon on a case that I think may really require an intervention, or to touch base with Dr. Palma to say, here's a case that I'm sending you, and I just want to make sure that we're ordering the right type of injection. Let's take a look at the MRI together.
You know, I described your group as you said you were doctors with hearts. What does that mean?
Well, I think it's an ultimate respect for medicine. I think the foil to advancing into the future is looking into the past. I think the role of a physician is a fundamental role of always looking out for what's best for the patient. For me, I have a strong involvement in volunteerism as the previous president of Operation Rainbow, an organization that operates on children around the world. And it's allowed me to also care for my community. Not only do I do cutting-edge sports medicine and joint replacement, but I care for the children of my community and the elderly, who are equally important to me.
You know, I pointed at the outset that you were what is called you are a neutral physician for the NFL. A neutral physician. Oh, now that's cool. What does that mean?
Well, a neutral physician, I served as a neutral physician for Northern California for, I believe, 6 years. And a neutral physician is a very unique position. It's a position based upon your integrity, not to take any bias from any other person, from a coach, from the Players Association, from the Labor Council. You evaluate the athlete and give an unbiased opinion as to what the injury is, what the treatment is, and the specifics of how serious. And return to play is a big issue.
That's the key. Is his career going to continue or not?
That's the key. And I was incredibly impressed with professional athletes. One of the things that I was so impressed with is they would always say the same thing. Doc, what do I need to do? And they would listen so intently because they realized that their bodies were their livelihood, and they were extremely compliant patients.
And I should point out, each one of you is board certified in your respective area of specialty, which is also very, very important. When we come back, we're going to be joined now by our pain specialist, Dr. Claudio Palma. He's also an anesthesiologist, and we'll take a look at that aspect of this practice in a moment.
We have been watching the operations of an organization which is doing its part to keep America strong, and we've been learning from its leaders about what they're doing to help move our country forward. This organization represents companies across our great nation that embody the spirit, dedication, know-how, and can-do attitude which has made America the great nation it is today. And now let's present the Keeping America Strong Award.
Now it's my honor to present this very prestigious award to the Soma Orthopedics Medical Group of San Francisco for the outstanding work that these doctors are doing to help keep America strong and help keep this country healthy. Dr. Atkins, I'll hand this to you. Congratulations, sir.
Well, thank you, Doug, and thank you, Heartbeat of America. I think first and foremost, as community-based physicians, we want to thank our community and our patients, and I want to thank my partners, Moshe Lewis and Claudio Palma. It's a great honor to be here. Thank you.
Congratulations for earning the Keeping America Strong Award, which honors innovators and leaders like you who are the heartbeat of America.
Our thanks to retired Rear Admiral Kevin Delaney for taking part in the presentation of the Keeping America Strong Award, the award that salutes small to middle-sized organizations who are helping to move America forward.
If you'd like more information about this medical practice, you can find it on the web. The address is somaortho.com.
That's it for Heartbeat of America's special edition, Keeping America Strong.
Now for a final word from William Shatner.
I'm William Shatner. Thanks for watching.